fact, the reason we take aspirin at low doses daily, some people, is to prevent the clotting of blood and thereby prevent heart attacks and strokes that can happen with inappropriate clotting.
There's a lot potentially to unpack here, but to reiterate some of what you said for people, non-steroidal anti-inflammatory drugs like aspirin are inhibiting parts of the machinery that takes you from certain lipids to lipid-based mediators of inflammation and clotting, things like the prostaglandins and the thromboxanes.
Right.
And so these things come from something called arachidonic acid. And this is itself coming from polyunsaturated fatty acids that we ultimately get from the diet. Is that right?
Well, yes, eventually, yes.
So this is a whole sort of lipid-based inflammation system.
Yeah.
These are fatty molecules.
Yeah.
Okay, so aspirin inhibits COX-1, COX-1. That's one of the key enzymes in this sort of picture. And this is just a normal part of how the body regulates inflammation. Through some forms of inflammation come from these lipid-based things.
Yeah. And clotting. So there's been these two aspects to the function of COX inhibitors. Mm-hmm. They can prevent clotting, they can prevent inflammation. But what's intriguing about aspirin when taken at low doses is aspirin has a remarkably short half-life. So its effect on both COX-1 and COX-2, so there's two cyclooxygenases, its effect on cyclooxygenases is irreversible. So once aspirin has irreversibly acetylated its target proteins, they're out of action. But aspirin only lasts around in the bloodstream for a half-life of 15 minutes. So it's constantly halving in concentration, and 15 minutes, half the concentration by 30 minutes.
Okay, so it's short-acting, but it's very effective at what it does.
Yeah, so it's very short-acting. It lives around for a very short period of time. However, the target molecule for the inflammatory context, COX-2, is expressed by nucleated cells. Because they have a nucleus, they can make messenger RNA, they keep renewing their pool of COX-2 all the time. COX-2 has a very short half-life. And so it's thought that once daily low dose of aspirin, very little affect the inflammatory COX-2 pathway, because COX-2 is constantly being replenished. Though, when you first give it, COX-2 will be irreversibly inhibited. Yes. That pool of irreversibly inhibited enzyme is replaced by new.
And when people, I've heard a lot about this in different contexts. When people take low dose daily aspirin or something close to that, can you give us a sense of A, what is low dose for an adult, say, and B, what types of people are taking aspirin daily or are commonly advised to by physicians?
So a low dose of aspirin, the exact dose differs in different countries. In the UK, it's 75 milligrams, because that's the sort of tablets you get over here. In the US, it's 82. So it's anything sort of really below about 100 milligrams.
Yeah, that would be considered basically low dose.
Low dose aspirin.
Yeah.
And people get prescribed aspirin to prevent thrombosis, basically inappropriate clotting of blood. Mm-hmm. And that can happen in people with certain atherosclerotic processes. So people with heart disease at risk of getting strokes or getting heart attacks might be asked to take daily low-dose aspirin to prevent the propensity of their blood to clot. People with certain heart dysrhythmias, for example, if they have atrial fibrillation, used to be put on daily low-dose aspirin. It's really to stop clotting.
Yeah.
It's not really to target inflammation. If you have a fever and you need to take aspirin for it, you'd have to take a milligram 4 times a day or something thereabouts. So, you'd have to take a hugely greater dose much more frequently. So
there's multiple things downstream of arachidonic acid. Aspirin fits into this picture, but it's really the thromboxanes, the things that are involved in clotting, that people get prescribed daily low dose. So when basically what you're saying is when people have or might have or be at risk for heart issues, cardiovascular issues, those types of people will often get prescribed or recommended by a physician low dose aspirin because it has this inhibitory effect on the creation of these clotting factors called thromboxanes.
Yeah, that's exactly right.